Hi, I'm Chantelle Evelyn, producer of Another Bajan, and today I am taking a little pause from bringing you stories for a more than worthwhile cause, that being my health, specifically the health of my breast. Today is Mammogram Day. We're going to talk mammograms, we're going to talk self-exams, and I'm hoping that at the end of this, you pick up the phone and make your appointment to get your checks done. It's time. You know it is. Come, let's go. Just a couple of reminders, ladies. Wearing a two-piece outfit will make the process a bit easier. Also, remember not to wear deodorants, lotions, or powders under your arms or on your breast. If you have a referral from your doctor, remember to walk with it. If you don't have one, don't worry. Just make the call and you will be accommodated. I've had a mammogram before, so I'm not too daunted by it. It's not the most pleasant thing, but it's not the end of the world either. And I know I'm in good hands here at the Cancer Society, so I am good and ready to go. My mind might change in 2 minutes when they start squishing my breast up. But as for now, I'm ready.
So I'll just go over what I'm going to do.
Okay.
I'm going to do each breast, this direction first, and then I'm going to turn the machine so it goes right side, and then position you to get the right side of your right breast.
Okay.
And then it comes on this side left, turn you to get the left.
Okay.
It is a bit uncomfortable, but I have to turn you to get the breast in the correct position.
Okay.
Now you will feel some pressure because the system does hold the breast to take the images, but it should not be painful.
Yeah.
If you're having any pain or you feel like your skin is pinching or pulling, you let me know.
Basically, a mammogram is just an X-ray. And it's an X-ray of your breast. Just like you have an X-ray of your leg or whatever, it's an X-ray of your breast.
Shannon performed my mammogram and she was fantastic. She made sure I was relaxed and properly positioned for the best images. As she explained, we took images on both breasts and from different angles. The entire process wasn't long, just a few minutes and it was all over. My breasts have been squished. It's all good and it was not so bad. You can do this. If I could do this, you could do this. It's really not that big a deal. My breasts feel fine. You only feel the squishing when the squishing is happening. But after that, back to normal.
Mammogram is only one of the three protocols for early detection. The first thing is breast self-examination, which we're encouraging, and the focus this year is on breast self-examination. And we advise people to do it once a month. And then the next thing is not only women, men, because remember, men get breast cancer too, even though it's less than 1%, but they do. The second thing is to have your breasts checked by a health professional once a year. And I tell my women all the time, wherever you go for your pap smears, please say to them, please remember to check my breasts. I'm checking it myself, but just, I'm a second person to do it. And then the third thing in the protocol is screening, mammogram screening. Now, screening means you're coming in to have your breast checked and to do your mammogram screening. The mammogram machine will take pictures of your breast, and what we're looking for, any changes that is suggestive of breast cancer.
Okay.
Now we've moved on a little more and we're doing ultrasounds. It's not really screening, but we do ultrasounds on all women with dense breast tissue. Now in 2011, the law was passed in California that you know what the Americans are like. All women with dense breast tissue should be offered an ultrasound Now that wasn't happening here. So eventually we implemented that. Over here. Good. Fine. Now, I'm going to teach you how to do breast self-examination, and I'm also going to do the breast self-examination.
Okay.
Well, there's two parts in actual fact of breast self-examination. One is visual, which is what you look at yourself in the mirror, and the other one is manual or physical, where you can actually put your hands on and feel. Good? So those are the two things. So you look at yourself in the mirror, you can put your hands to the waist, or you can put your hands above your head. Okay? Now what are we looking for? We're looking at the two breasts. You're looking at the shape of the breast. You're looking at the size of the breast. You're looking to see if there's any difference between the two breasts, which is very important. Now, most people have one breast bigger than the other, and that's norm. So you just reassure yourself, but we reassure the patients it's normal to have one breast bigger than the other. And then you look to see if there's any color change on one that's not on the other. Okay, but the shape is very important. And actually, with your hands to the waist, you can actually see if there's a little lump, because there might be a little bulge. You might see what's called puckering. You know, if you sew and you pull the thread tight, that's called puckering. When you pull the thread tight, the way it pulls the fabric, that's puckering. You might even see that. You can also see the nipple. Now your nipples, normally some women have nipples that are inverted and others have nipples that are out. Now if you have always had nipples out, and then within the last few weeks you see your nipple pulled in on one side, that's important, because that's a change, right? And the reason that we do this every month, or at least every 2 months, is so that you're looking for changes. And if you do it often enough, what we're doing, we know the norm. That's the most important thing. You know the norm. Everybody knows what their normal breast is like, right? So when there are changes, you'll be able to identify it. Now the physical or hands-on, the best place I find is when you're having a shower. There's soap on your hands and soap on the skin, so your hands will slide. And you can do it in bed. When you're lying down, now the breast is spread out. Some people find that easier. I don't, but it just depends on your breast and on the individual. Now, if you're in the shower, you're going to do the same thing. If you're going to examine this breast, you have to put the hands above the head. Okay, and you use these 3 fingers. You don't use the tips, and you don't use the whole hand. You just use the pulps of these 3 fingers, or the soft part. And you start wherever is most comfortable for you. You can start on the outer side of the breast. And there are 2 movements you can use. The up and down movement, like that. Just slide your hand, and it's amazing how it slides with soap on it. And you go right down, go right wrong like that, go through like that, but slowly, of course. And you go, come back to where you started. Or you can start on the outer side of the breast and go round like a circle in one direction, but don't do this. That's definitely wrong, because you can miss a spot in between. So you slide it around like this, and you keep going, right? And you have to focus, of course. And you keep going. Don't ever take your hands off until you're done. Come back to where you start. Then you come closer to the nipple now, and you go around again. You see, and you press with it a certain amount of pressure, but not a lot. You come back to where you were, and then you go around again until you get to the nipple. It's as simple as that. People make a lot of fuss, but it's so simple. Okay, and then when you go to the other breast, you put this hand above your head, and you do the same thing. And then you put your hand under your arm. there's a little space up here called axilla, and you put the same fingers, but you can use 2 fingers now and go up, 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 and you'll feel a little hole up here, and put your finger in that hole, the same finger in that hole, and see if you feel any swelling. You do the same on the other side. And then lastly, the nipples now. You get the nipples in between this groove here, like that, and you go so, gently. And then you go this way. I'll demonstrate that now.
When do I start this? When do I start checking my breast and coming for screenings at what
Okay,
stage?
but you start checking your breast from the time you're in your teens.
Teens?
Yes.
Okay.
We so want to start going into the schools, to the secondary schools, but we have to get permission from Ministry of Education and all that. So, hoping that would happen within the next few years,
Okay.
so that the young girls and boys will know to check their breasts.
Okay.
So you start checking yourself in your teens, and then we start mammogram screening. We follow the American Cancer Society protocol, and they start at age 40.
Okay.
But it's not written in stone. You start at age 40, yes, for the average person, but if there's a family history or there's any reason for you to do a mammogram, you go ahead. Why we don't do mammograms in younger people? That's always a question. And that is because the breast tissue is very dense, and the radiation might not be able to pass through to pick up changes. We have to remember one thing, ladies, and that is mammograms save lives. Early detection of breast cancer saves lives. Breast cancer is no longer a death sentence. It's a life.
It's time that you just schedule the thing. Stop wasting time and come and schedule it. Meet with Dr. Jhagroo, meet with Donnie here, and get what you need to do done. You're wasting time. Every day is another day that gone. I don't know how much longer y'all expect to put this off, put it off, put it off, put it off. Put it in your calendar now. Open your phone. Your phone ain't open yet? Open your phone. Go to your calendar and put in a date. Wait, no, before you do that, you gotta call the people. Call the people, make an appointment. Put the appointment date in your calendar and get it done. It is hard. You're making it harder than it got to be. Go get your breasts squished. No.